Fannie Lou Hamer. She was an icon of the civil rights movement. And she talked about when she got ill and went into the hospital to be treated. And she ended up with something called the Mississippi appendectomy. Have you ever heard of that?
No.
So the Mississippi appendectomy was basically a way of performing eugenics in the Black community by, when a Black patient came into the emergency room or into the hospital with pain.
Gosh.
For example,
I think I know where you're going.
Yeah.
Hello, welcome back to The Bleeding Truth. My name is Sally McNally and I'm the Irish midwife. And today we'd like to talk about a very, very important subject about the dangers of being a Black woman in American healthcare system. I have a very interesting woman. She's going to talk to us and educate us on this subject. Her name is Dr. Gail Joseph, and she is a part of our community memorial healthcare system. She's an OB-GYN doctor, and she practices full spectrum obstetrics and gynecology. She has a passion for women's health, with the platform of educating patients as a means of encouraging health-seeking habits in high-risk populations and promoting equity across the healthcare arena. Thank you very much for coming to join us today, Dr. Joseph. Please tell us a little bit about yourself.
Well, thank you for having me, Sally. I appreciate a chance to sit with the notorious Sally McNally and and share my thoughts. I think you said quite a bit. I've been here now in this community for about 3 years, and it's a great area to practice. It's a lovely little community, lovely little beach community that I enjoy, and I'm looking forward to continuing to make an impact here for as long as I can.
And you have a unique perspective on all of this because you are a Black woman and an obstetrician and gynecologist. So our patients are really, lucky to have somebody like you.
Thank you.
But I would like you to maybe tell us, what are the specific risks for Black women during pregnancy and postpartum, and how do they differ from other groups?
Patients of African descent tend to bear the brunt of disparities in medicine, whether it's being more at risk for basic cardiovascular illnesses, being more at risk for things like diabetes, being more at risk for being misdiagnosed, being more at risk for being undertreated, being more at risk for not being heard, not being listened to. These are some of the things that come to mind most notably when I hear a question like that. And I have a story about that. I want to actually get into that with you a little bit later because this actually just happened yesterday. I was on the phone with a friend of mine, a former colleague from up north, and he was telling me about his wife's birthing story. He's an African-American physician and telling me about his wife's birthing story. So that would be an interesting one to tell on this podcast today.
Yes, thank you. I honestly feel that really helps us to understand when we put a face to it or a complete story around the woman. Yes, please, I want to hear that story. But why do you think it's 2026? Why do you think Black women have to still put up with this? What's going on that we haven't, evolved in this way, that we can see Black women, as a complete human being and know their special needs?
A lot of it is ingrained stigma that comes with our melanin. Melanin is looked at as a disease, it's looked at as as a problem in a lot of settings. And that mindset or that way of thinking, it's not new. It's been a way of thinking from the very first. I mean, it's Black History Month, so I'm just going to use terminology that can be attributed to Black History Month. From the very first boat landing in the Americas or the Caribbean or, South, melanin has been looked at as an issue. Melanated skin is an affront to a lot of people. And those ideas that Black women are, more difficult, they complain more, or are just, not as valuable as their counterparts, have never left us. They've never left certain aspects of our society. And the reality of it is, African American providers are not pervasive in our community. So we don't have many of us listening to the rest of us. We don't have, and I know this may differ in small pockets of the society, depending on where you are. But in most places, we don't have a lot of African American providers who can relate to what their African American patients are going, or an African American patient is going through, is how I should put that. So when I, as a Black woman who's not a physician, comes into a physician's office, I'm seeing people who do not look like me, who don't understand my perspective, or who may not understand my perspective, I should say, and who are probably, or were probably, taught early on in life, whether, subconsciously or outrightly, that, Black women are just not as valuable as you are. So, you don't have to waste a lot of time listening to them. You don't have to waste a lot of time talking to them. They're going to complain. They're going to be more difficult to deal with. Just, hurry up and move on. And in some settings, we're seen as a threat. Even when Black women come into certain spaces, we're expected to be difficult. We're expected to make other people feel unsafe. Okay.
Yeah.
And
I love that. I love that you're opening up and talking to me like this. This is really interesting.
And so I think that's a big part of why a lot of this disparity still persists, because we don't engender the kind of compassion generally that lets people understand us enough to dispel a lot of those myths about who we are as Black women.
Yeah.
And so, there's studies that talk about children in the emergency room, Black children in the emergency room versus white children in the emergency room. Your parents are coming with you. Usually it's moms that are coming in with their kids. And they're seeing that Black children who are coming in with, even broken bones, for example, are less likely to be given adequate pain medication than their white counterparts.
I've witnessed that in the labor rooms throughout the years. Honestly, I have. That there's the perception that Black women don't feel pain the way the white women do.
Absolutely.
Absolutely.
There was actually a resident study about this, where the residents were asked about what they felt were qualities in Black patients versus their white patients. And one of the things that came up was the fact that a lot of these non-Black residents and this was a study that was done, I think, in the teens, like 2017, 2018. In that time point, a lot of these non-Black residents still felt that Black patients do not feel pain the way that their white counterparts do, that their skin is actually thicker, literally thicker than their white counterparts. It's troubling that thought process like that still exists in our community today, but it's a reality, and we have to figure out a way to, again, work harder at dispelling those myths, but at the same time, come together in a way that we can sort of understand each other's perspective, because you're not born with those perspectives. They're ingrained in you at some point in your life as you're growing up or aging. And I hate to say it this way, but it's the truth. Sometimes you can't help the way you feel. That's what I'm getting.
We all have to do training in racial bias in our to know our own biases, and I think it's really good idea to do that now. when I meet a patient who's Black for the first OB visit when she's coming into our office, I immediately tell her, you're at higher risk. And as we go through your pregnancy and labor, we're all going to be watching you for certain problems
Yes.
and
Yeah.
working to keep you safe, because we know just because you're a Black woman, you're at higher risk.
Absolutely.
And I know that some of that risk factor is because of the bias, but also some of the risk is because of the fact that she's a Black woman, that she has certain risks like hypertension, diabetes.
Well, I think a lot of those legitimate risk factors, like the hypertension, so the cardiovascular illnesses, diabetes, etc., um, they are more based not so much on the fact of the color of her skin, but
Yeah.
of the environment that we tend to develop in as African Americans. We traditionally grow up in poorer households where, commodities are limited, resources are limited. Food resources have been lower quality in our communities. There's a lot of communities that are predominantly Black communities where you can't find a Whole Food supermarket in those communities,
God,
and
yeah.
unless you're in a farming town where you can buy vegetables fresh from a farmer's market or something along those lines, or if you have space, which a lot of us don't. I grew up in an inner city. I did not have space to farm to grow vegetables. Unless you're in a space where you can help yourself by growing fresh vegetables in your garden, a lot of Black families don't have vegetables on a regular basis. We're eating out of cans. We're eating out of
Yeah.
boxes. Okay. And so that puts us more at risk for routinely consuming high fat, high salt. The one thing you will always find in a poor community is a McDonald's or a Burger King, or, you name the fast food
Yeah.
restaurant, we have one. And so we're more at risk for consuming those things routinely. And that's what's increasing our risk of all these baseline health disorders that are perpetuated in our communities because we just don't have the resources to get out of those communities and or turn things around. I mean, there's a lot of influencers now online who are teaching people in the inner city how to homestead. That's great. I feel like if you can latch on to those ideas, even a community garden, if you can latch on to ideas like that and help out in your community by developing something like that, fantastic. But even that requires resources, you know what I mean?
Yeah.
Which a lot of people may not have, even time resources. Growing up, my mom always worked two jobs. So I would see her at 4 o'clock in the morning when she was leaving. I wouldn't see her again until 4 o'clock the next morning when she was leaving again.
Oh.
And
Oh.
so, where would she have found time to homestead or share a community garden or,
Yeah.
do anything that involved helping her community develop a more healthy way of eating or thinking about food? It's
Yeah.
just not possible because our communities traditionally, our moms and dads are spending more time in the workforce, literally trying to sustain us at the most
Yeah.
basic level, keeping the lights on, keeping the water on, making sure we have money to pay for school supplies, making sure that our medical bills are paid, things like that.
So you're saying really that it's not that you're born with this physical problem, it's that you develop it due to your environment.
You do. And then the familial aspect of things kick in where people in the same environment have the same illnesses over and over again because they're eating the same foods. They
Right.
are they maintain the same habits.
Yes.
The coming home from
It
work and being too
becomes,
exhausted to even go to the gym or go
yes.
for a walk, things of that nature.
Yeah.
Um,
Right.
it's not so much always genetics, although the research does show that in
Yeah.
a lot of Black and brown populations, whether you're Black, whether you're Indian, whether you are Pacific Islander, you genetically are more predisposed to having, for example, diabetes. You see more diabetes in these populations. But their diet and their way of life is a strong contributor as well.
So where do we start with the proper education? Is
Mhm.
it in schools? Is it in the medical schools? Is
Mhm.
it how do we fix this? How do we make it better for Black women?
I think it has to start in our schools. It has to start with our little children as they're growing
Yeah,
up. Us as adults in the African American community making time to change that way of thinking from a young age, talking to our children about the value of fruits and vegetables and exercising and eking out time to show them that example. Okay.
yeah,
But also once they are out of those formative years, as medical professionals, I think it's upon us to make sure that when we see women of color come into our environment, that we receive them appropriately, make them feel safe, and make them feel heard. I feel that a lot of times, and I've had this experience myself, where I go into the doctor's office to talk about something that's bothering me, or some issue that I feel like needs to be investigated further and treated, and we end up talking about my eating habits and my body mass index, etc. And yes, those things tie in, but that's not what I came to you to talk about. Do you know what I
yeah,
mean?
yeah,
And we need to find it in ourselves to make this community of women, Black and Brown women, feel more heard when they're in the medical uh, setting.
yeah. Just recently, I watched a video on social media. This woman in labor sitting in a wheelchair telling the nurse, I'm in labor, and she's
Mhm.
crying out in agony. And
Mhm.
the nurse is like tapping away. And I don't know how she decided that she wasn't in labor,
Mhm.
but that lady was sent home
Mhm.
and delivered like really very quickly
She
outside
delivered
the
she delivered in
hospital
her husband's truck. There were two of
in
them
the
actually. There
truck.
was
Yeah,
that case and the another
yeah,
case very similar where the young lady was literally writhing in agony in a wheelchair, and the nurse was sitting next to her asking her all the intake questions, which are important, right? But you can answer intake questions later.
yeah.
Um, that patient, 12 minutes after they got her to a room, finally she delivered a baby. You know,
But the ignoring this, just staring at the screen and
mhm.
ignoring this human being,
I remember that
yeah,
video. I remember the nurse did not
so
even she did not
cruel.
even make eye contact with that patient. That was
You,
disheartening. And
she didn't
that
care.
yeah. And the
Yeah,
patient's mom sitting across was filming everything, and at no point did she say, "Well, let's get you to a room and let's get your mom to answer some of these questions," for example, right?
yeah.
That patient, that family for sure did not feel heard that day, for sure.
Yeah, I mean, I don't know what was going on in that nurse's head at the time, but it was
Mm.
disgraceful. Yeah.
But I think that
Um,
speaks to, I mean, there could have been other things going on. For example, maybe at some time point in the past, she was written up for not doing or not going through the proper intake steps before admitting someone. I don't know what was going on in
yeah,
her head. I can't speak for her.
right.
But this idea, or this perception that we all get when we look at that video, that she does not even recognize the agony that this woman is in. I think there
Yeah.
you have to call out the colorism in that, because
Mhm.
we all know that were she less melanated, she probably would have been in her room much faster than she was, you know?
Yeah. Yeah. So a lot of what we're watching is not so much that the Black woman has poor health, but the person looking after her has a racial bias.
Hmm.
So I know some of our peers don't like us saying that because they're like, they scoff and they say, no, I would never treat a Black woman like that.
Yeah.
Um,
Well,
but statistics show, right?
Statistics show. I mean, we can go as far back as, even pre-civil rights. Let's go back to our field, Sally. Let's talk about what happened in our field that even shapes the way that you and I, you the midwife, me the physician, it shapes the way we practice today. What do we have access to? J. Marion Sims. Everybody knows about him. He's the father of modern gynecology. Yeah. How did he
The
gain his
Sims
notoriety?
forceps.
Right? The Sims forceps. How did he develop those Sims forceps? Well, he was working on enslaved Black women. Okay. They were the property of their masters. And so they did not have a choice as to what was going on with their bodies. And the master would give these slave women to J. Marion Sim to work on. And he would perform procedures on them without anesthesia, because at that time it was felt that they did not perceive pain as much as their white counterparts did. And he did some of the same procedures on white women. We came to find out later, but gave them some form of anesthesia, whether it was ether or whatever they used at the time. But on the slave women, he did not use any anesthesia. But he was able to work on them enough to be able to develop the forceps that we're using. On some patients, he did the same procedure over and over and over again. There were three notable women. One of them, her name was Betsy. She was a young girl who had a bladder problem and developed an issue with voiding her urine. And he actually created a fistula in that Black girl to try to sort out whatever the issue was with her. That did not work out great. There's also Anacha and Lucy, who were two slave women who were owned by, I believe they were in Montgomery, Alabama. In any case, they did not give any consent. They were not able to give consent. Their slave masters gave consent for them, and they had no choice as to what was happening with their bodies, and were operated on multiple times in the process of him advancing medicine, right? We have, even outside of that, even outside of the realm of feminine, we have a Tuskegee study, which we all know about, where we had I think this happened over a 40-year period from, I think it was 1932 to 1972. And this involved the public health services in Alabama, all this kind of happening in the South. There were several men who were put into a study category where their syphilis was not going to be treated. And they would observe them to see the outcome. And of course,
I remember reading about that. Yeah.
And of course, in the process of that, many of them died and had irreparable damage done to their bodies, but also their wives did, right? The women in those scenarios suffered as well, because if you don't know that your husband has syphilis and is not being treated for syphilis, and you're performing your wifely duties, then you're going to get it too, right? And the children suffered because, congenital syphilis, yes, etc.
So terrible.
And fast forward even further to 1950s, I believe it was, Henrietta Lacks. We all know about the HeLa cells. We all learned about those in biology class, where she had cervical pathology that was diagnosed, and a sample of her body was taken without her consent. And it took generations for her family to even, one, recognize that something was happening and get some restitution for that. And I think even today, there's still some lack, I would say, in how the family is recognized for their contribution to that. One of the other notable events as far as Black women's bodies being exploited in medicine is Fannie Lou Hamer. She was an icon of the civil rights movement. And she talked about when she got ill and went into the hospital to be treated, and she ended up with something called the Mississippi appendectomy. Have you ever heard of that?
No.
So the Mississippi appendectomy was basically a way of performing eugenics in the Black community by, when a Black patient came into the emergency room or into the
Oh
hospital with pain,
gosh. Yeah.
um, for
I think I
example,
know
they
where you're
had their,
going.
yeah, for example, you have appendicitis, well, you need to get your uterus taken out as well,
Oh
and
God.
and so a lot of women were subjected to, a lot of Black women were subjected to that um, in that time. I say all that to say that those biases that caused that treatment of women of color to be
Yeah.
perpetuated all the way through so many decades, so many years, they're actually still alive today to a degree. I mean, there's protocols
Yeah.
and processes in place and laws that limit what can be done, but those
Yeah.
biases haven't really gone too far away. We just saw very recently in the news where the person who holds the highest seat in the land posted a meme online of our former
Oh,
president and his wife
yeah.
as apes. And
Disgraceful.
I feel like there was not enough outcry about that from the people that you would expect to have something to
Yeah.
say about that. And that
Uh-huh.
is telling in the sense that this is how a lot of people still feel today.
Yeah.
And those people are your doctors, those people are your even
Yeah.
religious leaders, those people are in the Senate, those people are teaching your children, those people are cooking your food, they're driving your buses, they're flying your airplanes, they're everywhere.
Yeah.
That's our world.
It hurts just listening to you talking about this. It's
Yeah.
all of those stories that you just, and they're such great examples of
Hmm.
what is happening.
Yeah.
I myself, being Irish, I have had a little taste of racism, nothing like what you would have had to go through.
Hmm.
Um, or other Black women, of course. But like, people hear I'm Irish and they immediately think I'm a drunk. And I don't even drink alcohol.
I know.
And
I know.
or they want to talk about potatoes and
Hmm.
stuff. I
Hmm.
do like potatoes, mind you, but I did have on one occasion in my life that it really stuck with me, and I always uh, try to remind myself that I must never be like that. I worked over in the Middle East, and I was when I started the first day, they gave me this apartment where I was to live with two English nurses.
Hmm.
And as soon as I walked in, I'm like, "Hello, my name's Sally, and I'm the new midwife here." And they didn't talk to me. They just walked
Hmm.
by me like I
Hmm.
was invisible. And
Yes.
I was so sad, and I didn't understand that. But later I realized that's what racism is. That
Yeah.
it was, they hated me because I was Irish.
Yeah. Yeah.
And I spent months trying to win them over and be likable,
Hmm.
and no, it was like in their heart,
It was.
and
And
it
that's
was in their
exactly.
DNA. It was,
Exactly, because they don't know
yeah.
Sally. If they knew Sally, they would never have that. They would never, they would
But
never
it was
have that thought
shocking.
process to begin with, right?
But it was
Um,
shocking. It was so
yeah,
shocking. It's still in me that I
it is.
remember it so
You
well.
remember, yeah.
So, and I know that you, being a Black woman, I'm sure you come across that way more often.
Mhm. Yeah,
Um,
yeah.
and I apologize
No, I mean,
for
I
what.
feel that a lot of my experiences have shaped who I am as a physician. I mean, I still have work to do. There are times when I have to stop myself from, you know, thinking in certain ways or prejudging. We all get into those scenarios. However, a lot of who I am as a physician was shaped by the experiences that I went through, whether it's growing up in a country where I did not have access to a lot of resources, to coming to the United States and resources are all around me, but I still don't have access to them.
Yeah.
I have a vivid recollection of one of my first well woman visits where my physician was performing my breast exam, and her partner opened the door and stood there with the door open and was discussing another patient with her while my breasts were exposed. Um,
Oh,
I, you know, in college, my interactions with counterparts, in medical school, interactions with counterparts, and even in residency, oh boy, in residency, that was quite a learning experience for me. I did my residency training in the South, and those ideas, those thought processes are alive and well,
mhm.
and we're not immune to them just because we're women of color, but on the side of the table where we're providing the medical care. Because even as
Mhm.
physicians of color, those biases are still extended to us. We're not expected to be as smart. We're not expected to be as capable. We're not expected to be as eloquent or articulate as our counterparts. And there are numerous examples where um, we're not going to talk about, um, well, you know what? Let's talk about it because it matters.
Yeah,
Because,
because the minute I met you, I knew you were a strong woman. I
oh,
love
thank
strong
you.
women. I knew you were so strong because you must have gone through so much
Yeah,
to
yeah,
to be who you are today.
yeah,
Yeah.
yeah.
Tell us. Tell us all about it.
What I was getting at is across the board, physicians of color make far less money than their counterparts do. We're not reimbursed on the same spectrum,
Whoa.
and it matters because the communities that you end up in practicing medicine, the people who need you the most may never see you because those communities aren't paying you enough money to subsist as a young physician. And so you have to end up
Yeah.
taking a job in another community where you don't see as many people of color, but you're making a little bit more money and you can take care of your family and do a better job at being an adult in this world. um, it matters across the board, whether you're a patient or you're the provider. The color of your skin today still matters significantly. And it shouldn't, but it does. And I think it's going to take a lot of education, not just physician to patient, but even physician to physician. I think we have to, as physicians of color, learn to embrace each other and educate each other and sort of form an underground railroad in the world of medicine, so to speak, to get us all through, whether it's in your training years or in your years as an attending, to get each other through safely.
Wow.
Yeah,
It's so sad
yeah.
to hear that.
Hmm.
It just breaks my heart.
And this
Um,
brings me to my story that I started out mentioning to you.
yeah.
My colleague up north called me up just yesterday, Sally, to tell me about his wife's birthing experience.
Yeah.
And mind you, he is someone who has been in the hospital system that I used to work in for years. He
Yeah.
is on the executive committee. We were on the executive committee together. He is part of their directorship. He's ingrained in the community, so people know him. They know who he is. And
Yeah.
his wife went into labor in a very dramatic way um, about a week ago, and was admitted to hospital with very concerning symptoms. And it took hours of him trying to advocate on her behalf and
Yeah.
questioning, asking many questions, calling, phoning a friend, phoning another family member who's also a physician, um, even calling to speak with other heads in that hospital
Department.
environment to
Yeah.
get her what she needed. And she ended up having a postpartum hemorrhage that was pretty severe and being very much inadequately treated, is what it sounds like,
Yeah.
for over 24 hours. I mean, she almost died.
God.
She almost died. And this is someone who, again, is a part of, formulating even the protocols that are supposed to protect
Yeah.
his wife when she's in that setting. But you walk into that setting, a man and a woman of color, I remember him mentioning that he hadn't seen the doctor for sometimes hours, and he would make suggestions to them that were being blown off. He felt were being blown off. He didn't feel, again, like they were being heard. He didn't feel like nursing staff was as aggressive in terms of communicating with the physician about what his wife needed. It was just one thing after another. And it seemed straightforward. I feel like it would seem straightforward to you and I as practitioners in the
Yeah.
field of obstetrics and gynecology, but it just did not play out that way for him. And they ended up with a poor outcome. I mean, the child is fine, mom is fine now, but it took a while
Yeah.
to get to that point, is what I'm getting at. And he is a
So
physician. He's a
terrible.
physician. He's a
And
physician,
he
but a
knew
physician of
something
color.
was wrong.
Yes. Yeah.
Yes, he knew something was wrong,
Yeah.
and he didn't get the help. And we hear that story over and over again,
Yeah.
don't we? And maybe she's fine. Maybe she had a blood transfusion and finally it was all fixed. But it stays with you,
It
doesn't
stays
it?
with you. It's
It's,
traumatizing. Now
yeah,
imagine, were he not a physician who was able to advocate for his wife from
right.
a perspective of knowledge, what happens to our patients who don't have medical knowledge, who don't have someone to come with them as an advocate? What happens to those patients? They
Yeah,
don't always have an all's well that ends well story to tell, right?
yeah,
Um,
right.
I always encourage my patients, and I learned this from another physician of color who trained with me. I always encourage my patients to ask as many questions as you want. I think one of the things that happens a lot in my practice setting is that people think I spend too much time with patients. People
I
think
hear
I
the
spend too
same.
much time with patients, but
I get that all the
yeah,
time and I don't care.
I don't, because at the end of the day, I tell my patients, no, you can ask as many questions as you want. You're here for me to help guide you through this process. It is not me making the decisions. It's both of us coming together to make a decision.
Yeah,
I want them
you're
to
listening. You're
Yes, I want them
listening.
to know that I'm listening. I want them to know that I want them to feel like when they've left the office, they've had every question answered and they have enough information to, if they haven't made a decision already, to go home and talk with their family members about it and be able to make an educated decision about what's going on with them. I also encourage them, especially my pregnant moms, to come with an advocate. I think doulas are an amazing, amazing adjunct to medical care. And I wish
Yeah,
every single mom could have a doula,
yeah,
because
me too.
yeah, and there are times when I wish the doulas were more aggressive too, in a sense, but I wish every mom could come with a doula, so that when mom is writhing in pain, the doula can be the one with the clarity of mind to say, hey doctor, what is this medication for? Or hey doctor, do we think she needs to do X, Y, or Z? A lot of women of color don't have that. One, not because they don't have family members to come with them, but the family members, you see them at a lot of the time sort of cowering in the background because they don't want to make a stir. They don't want to be perceived as angry or upset or loud or overbearing. And so they sort of cower in the background and whisper to the patient when all the medical people have left the room.
Yeah, I agree with you. It'd be great to have someone there to help her.
Mhm,
But I also want to help our patients, especially our Black patients,
mhm,
to have a big voice to
mhm.
speak up for themselves.
Yes.
I always try to tell the patient, you're really our boss. You're
Mhm,
the one,
mhm.
making a job for us.
Yeah.
But also, if they just to find it inside themselves to say, stop, I
Mhm,
don't feel heard.
mhm,
This is what I want, or this is what I don't want.
mhm, mhm,
Like your friend and his wife, how sad. I mean, her milk may not come in as quick because she's so anemic.
mhm.
She's higher risk of postpartum depression. It's not
Absolutely.
just the trauma that they experienced in the hospital, but it's dangerous in so many
In so
ways.
many ways. And the emotional trauma of that could even affect how she's bonding with this child. You know what I mean? When,
Yes.
which then perpetuates into lack of emotional ties between mom and baby, contributing to sort of developmental issues moving forward in life. That translates into learning disability or
Yeah.
gaps or problematic learning styles or
Depression,
circumstances, depression, and
anxiety.
children go through depression too. And I feel like a lot of the times it's ignored or overlooked. And even as an adult, that could affect how that child interacts with the world around him or her, not having had those maternal bonds
Yeah.
as a neonate even, you know?
Yeah.
So it carries over across the lifespan of that child and across the remaining years of that family in general.
That brings me to a clever put together question that I had for you. How does the stress of these society factors, such as discrimination, contribute to mental health challenges for pregnant women? Of course, there's the discrimination, the racism, their physical health is in danger. But then
Mhm.
tell me more about the mental health dangers for Black women.
Mental health in general is very stigmatized in communities of color. And notice I keep saying communities of color because it's not just Black women. It's Black and brown women, and even women from who are not necessarily of color, but from other societies that are outside of our mainstream American society, right? But those stresses most certainly contribute to a decline in mental health through the adult years in women. But it's overlooked in a lot of communities of color because it's depression is not looked at as strength. And a lot of our communities are very religious. Let's start there.
Okay. Yeah.
And nothing against religion personally, but what I've found over the years, for example, is that we get told a lot to pray about things or to talk to God about it. And, I'm a huge proponent of praying and talking to God. I have no problem with that. But at the end of the day, it doesn't replace what your body physiologically is doing and whether or not you need an antidepressant to address your symptoms.
Mhm.
But many of us don't get that because we are either
Okay.
ashamed to seek it out, or there's enough stigma around it to where we don't understand it enough. We're not educated enough on it. No one ever talks about it. There are many of us who don't know whether or not our moms, dads, grandparents struggled with depression when they grew up in an era when they were probably very depressed because of the things happening around them and the want that they grew up in, right? But because we don't talk about it and because it's so stigmatized, a lot of women don't seek out help when they think that something might be wrong, or they perceive it as a sign of weakness when they think that something might be wrong. And so they don't talk about it. We don't talk about it amongst our friends. We don't talk about it amongst our colleagues. We hardly even want to talk to the doctor about it because there's that other side of the coin where we think if we get diagnosed with something, like depression, then we're considered to be crazy. That's part of the stigma. You're considered to be crazy and you're going to need to be on these medications for the rest of your life. And they see pictures of themselves in straitjackets and blah, blah, blah. There's just not enough education around it.
Yeah.
There's a lot of stigma around it. And I think a lot of that lack of education, a lot of that stigma comes from the stresses that drew out those things in the generations before, if that makes any sense.
Mhm. It does. Yeah. I have come across that a lot as well in the Hispanic community
Yes.
where they say I have postpartum. They don't want to say I have postpartum depression. It's like
Right.
postpartum. It's like
Yes.
something that's unspeakable even.
Yes.
Yeah. How do we help women with that? How do we draw them out so that they can feel safe enough to tell us they're not feeling happy or they're having postpartum stress disorder even?
I think one of the big challenges is going to be normalizing those transitions that women go through when they are in the peripartum phase of their lives.
Yeah.
Um, Normalizing the shifting in mood that can happen. Normalizing, when I say that word, what I mean is making sure that women understand that we all go through that. It's not just you. You're not isolated.
Yeah.
You're not broken. This is something that a lot of women go through. You may not hear about it a lot. And I say this to patients, I tell them, you may not hear your friends talking about this, and no one on Instagram is going to brag about this, but everyone goes through these. Every woman who's given birth more than likely is going through something similar to what you're experiencing. And I want you to understand that you're not broken, that there's something going on, there's a shifting happening in your body that is a part of the process of healing, and we can work through it. Making sure that they understand that they have a resource, they have people to talk to. I think one of the best things that, one of my favorite things about this community that I work in is our parent resource center. I feel that I love telling people that phone number and telling them, hey, when you leave this hospital, if you feel like you need to talk to someone, if you feel like you need to reach out, call that number. Call my office, call any of our offices, even call the nurses station and say, hey, something's going on. I need to talk to someone. But creating channels for them to access us when they feel like something is going on, and making sure that they understand that what they're going through is not strange. It's not ideal, but it's not strange. And there's help for me if I need it. Sort of dispel some of the myths and relieve some of the stigma around postpartum, make the word depression speakable again. I think that's one of the things that we need to do as providers to help these women get through this.
I love that. Yeah. I love that. I want to take you back to a moment that I felt when you were talking about your residency. Can you tell me who you saw, what they had said to you? What was it that hurt? I want to know who hurt you as a Black woman. Who was it that hurt you and made you feel that racism so strong?
My story is long and drawn out, but I think one of the first seeds that was planted in that process was one of the nurses at the hospital I worked at the time found me about maybe a year and a half into my journey as a resident. And she and I had become really good friends, and she had never said anything all this time. But finally, there was one day that she caught me, and I was sad. I wasn't feeling great. It was not a great day. I mean, a lot of us remember in residency or in our training years going home and just feeling like, oh, today was just the worst day of my life. I don't know if I want to continue this journey, etc. And she found me on one of those days and was just trying to give me a pep talk. And she wanted me to know, hey, it's not all you, there's people here that made you a target from day one. And she pointed out to me that she was at the nurse's station on my very first day on the floor as a resident when one of her white colleagues turned to her and said, I'm going to make her life a living hell. And proceeded to do everything she could to do just that.
Wow.
Yeah. So, and things like that still happen today. I think I have so many stories I could tell you about, not just myself, but other physicians of color who get put through the ringers just for showing up in spaces as physicians of color. But yeah, that is one of the traumatic memories that I have from my residency years.
It's so awful, isn't it? Not only she was like targeting you, like she was like a big bully, but she was another woman.
She was,
that she couldn't see the woman that you are, trying to help other women. It's like we're all on the one side, and I'm really sorry that happened to you.
Yeah, I mean, I take strength from a lot of the things that I've been through and a lot of the things that I still go through in this life. But
you have to show up, you have to be stronger, you have to be more prepared.
Yes.
Yeah. You have to if you make the mistake, it's like, look at it. She made the mistake.
Yeah. You have to
and some big old white guy could make the same mistake and nobody even notices.
Yeah.
It's
you
amazing.
Have to be 10 times as vigilant and 10 times as good to get half the recognition of your counterparts, is what my parents always tried to tell me. But
Yeah.
the struggle for me is always how that translates into the kind of care that my patients receive. Because when I have, for example, a nurse who intercepts me in that way and and perceives me with whatever biases are clouding her mind, inevitably you get some pushback. For example, when she would call to talk about a triage patient, and you'd almost find yourself bickering with her about the plan of care. Meanwhile, that patient is not getting what they need, and you, as the provider, you sort of know what the protocol says, you sort of know what the rules call for in this setting, but the nurse is refusing to do those things because she does not respect you as a physician, simply because of the color of your skin.
Wow.
The patients are hurt in that setting, right? The
So
care is
then
delayed, the
you,
quality of the care is diminished,
yeah.
etc.
And do you feel then that you have to be more forceful, which might come across as more aggressive?
Exactly. Exactly.
And
So it's
then,
sort of a death
yeah,
spiral that you find yourself in sometimes.
how can we make it better for not only patients but maybe black female doctors? What can we do? How can we, like, do we really have to sit down every year and go through the
Mhm.
training, the racial bias? And
Mhm.
I I know some doctors who get their MAs to do those
Yeah.
trainings. And so they never get it. They
They
never.
never do, yeah. Recent times, one of the most disheartening things that I've seen is the sort of the dissolution of, and again, I don't want to get too political with our discussion, but it's hard not to in our society nowadays because everything sort of
Yeah.
bears on what's going on in our administration. But getting rid of those DEI regulations and um, all of a sudden, all the bias training disappears. How do you get that training to people who need it in settings where it is most crucial,
Yeah.
like in the world of medicine? I feel that it should be available to you across the board. And honestly, not just available. I feel like it should still be a mandate across the board. This is one of the things that I disagree with more than anything, getting rid of the racial bias training in medicine. But I feel like it should be a mandate. I really feel that if you're coming into into a setting where you're going to be caring for people from all different walks of life, there should be at least some groundwork in terms of how you learning how to intercept and care for those individuals in a more culturally and racially competent manner. Communicating, there needs to be more groundwork done in us as providers, communicating with each other.
Mhm.
I know that we have a lot on our plates already. There's still requirements that are or still things that are required of us as physicians, Sally, that they're
Yeah.
important, but to me, not as important as things like racial bias and communication that I feel need to be brought to the fore. I think the systems that we work within have to do more to keep those things alive and
Yeah.
make them important as part of the
Yeah.
care that's being provided to our patients.
Well, that's amazing. I honestly thought I was going to sit down and talk to you today about diabetes and preeclampsia and pulmonary embolus and high BMI. But really, I feel the spotlight comes back on my own racial bias that perhaps I have. That when I get it, the next black woman who's going to walk into my office, I'm going to say, how am I thinking and seeing this lady?
Yeah.
Um, and how am I truly going to keep her safe
Mhm.
in my care? And I've learned a lot just listening to you now. It's amazing how
Mhm.
we think we know
Mhm.
something, but
Mhm.
there's so much we have to learn. And
There's so much.
yeah, I really love that you spent this time with me. I could go on talking to you all day.
Well, let's
There's so
keep going,
much.
Sally. There's so much more where all that came from. Um,
Yeah.
but I absolutely understand. And I agree. I feel like conversations like this need to happen more often. This is how we're going to make change by, opening the lines of communication and sharing our thoughts on an open
Yeah,
platform.
yeah,
Uh, Maybe planting the seeds for other people to think about how they're feeling in the various settings that we come into in the world of
yeah,
medicine, for opening the door for patients as far as communicating with their providers. That's how change is going to happen.
yeah.
Um, yeah.
Well, for any Black women who might be listening to this podcast, um, I hope that you feel heard when you go to the doctor's office. I hope that you feel brave enough to speak up for yourself if you're not. I want you to know that there's white women like myself out here trying to make it better for you. And
Absolutely.
and then you also have women like Dr. Joseph here, who absolutely is making it better for you. We have a lot to work on. We have a lot
We
to
do.
do
We do.
still.
But it's going to be a team effort,
Yeah.
We all have to be of the mindset that the work needs to be done.
I'm ready. I want to work.
Yes, ma'am.
Well, I have to stop there because we're coming right up onto the hour.
Okay.
Um, but maybe this is to be continued in a
Yeah.
different way. I
Okay.
hope so.
I hope
Yes.
so too.
Thank thank you very much. Thank you
Mhm.
for all your stories. And of course,
Mhm.
podcasting, it's for
Mhm.
me, I'm a storyteller.
Mhm.
And it's the stories, you
Mhm.
all out there, whoever's listening, especially you Black ladies, we want to keep you safe.
Yes.
Um, and thank you for listening to The Bleeding Truth.
Thank you for having me,
Thank you.
Sally. I appreciated this time with you. I look forward to maybe finding another topic we can talk about someday.
Yes,
So
I'd love that. I'd love it.
absolutely. So, all right. Well, I will see
Okay.
you around the halls, and we'll continue to work together to
Yes.
bring spectacular care to our women of
All colors.
all colors.
Yes.
But
Yes.
opening our ears and our hearts more in the spaces and places where they need to be.
Yes.
Yeah.
Thanks a million,
All right.
Dr.
Thank you,
Joseph.
Sally. Take care.
Thank you.
Okay. Bye bye.
So thanks again for listening. We really appreciate it. And if you like what we're doing, give us a bit of a review on Apple. That would help us so much. And if you come across a subscribe button, press the subscribe button. It doesn't cost you anything.